You spent years in service. You have the medical records. You have an undeniable injury. Then the letter arrives. You open it to find a 0% non-compensable disability rating. The military acknowledges you were injured on their watch. They put the diagnosis on paper. But the VA refuses to attach a single dollar of financial compensation to it. The system feels rigged. But the breakdown usually starts before the paperwork is even filed. Veterans instinctively treat the VA claims process the exact same way they treat a standard healthcare visit. In a clinic, you are a patient seeking treatment. But when you step into the VA claim system, you are a claimant proving an economic handicap. You have to prove how your injury specifically limits your ability to work and function in daily life. A medical diagnosis is simply the prerequisite. It provides the baseline the VA needs to begin measuring your actual functional loss. When you see a civilian doctor, their objective is straightforward. They want to identify your disease, build a treatment plan, and minimize your pain. A compensation and pension, or C&P, examiner operates under entirely different rules. They are not there to heal you. They are conducting a forensic evaluation to see exactly how your injury restricts your physical movement and impairs your earning capacity. On the left, the civilian doctor cares about diagnosis. On the right, the C&P examiner measures functional loss. Same injury, different tools. The military instills a tough-it-out mentality. Carry that pride into a C&P exam, and you will sabotage your claim. If you grit your teeth and force yourself through a mobility test without showing discomfort, the examiner writes down that you have full functional capacity. That examiner is bound by Title 38, Part 4 of the Code of Federal Regulations. This schedule for rating disabilities demands rigid, measurable metrics. They cannot grant a rating based on your subjective complaints if the physical tests show normal movement. Treating an auditor like a healer results in lowball ratings and outright denials. Years of solid medical evidence become useless if you cannot translate them into the language of the examiner. The VA defines functional loss very specifically. They are looking for weakened movement, excess fatigability, and a lack of coordination that impacts your ability to perform ordinary daily activities. C&P examiners measure this using precise tools. They use a goniometer to record the exact degrees of flexion and extension in your joints. This scorecard illustrates how a joint injury is graded. Notice the middle row, painful motion. Under the VA's own rules, if you demonstrate pain during a joint test, even if your range of motion hits the normal marks, the examiner is required to assign at least the minimum compensable rating for that joint. Now look at the top row. Veterans often submit X-rays showing degenerative arthritis, expecting a high rating. But X-ray evidence alone usually caps your rating at 10 or 20%. To break past that ceiling, you have to prove severe limitation of motion on the physical tests. Securing an accurate rating requires physical vulnerability. You must stop moving the second you feel pain. Let the examiner see the reality of your daily discomfort. When veterans get frustrated by low ratings, they often try a brute force approach. They submit multiple claims for the exact same body part, using slightly different medical terms, hoping one of them sticks or stacks up. The VA system automatically blocks this. Section 4.14 of the rating schedule is the avoidance of cure-omitting rule. It explicitly prohibits the VA from evaluating the same manifestation of a single disability under multiple diagnoses. Filing 3 separate claims for knee pain, instability, and arthritis wastes everyone's time. The examiner will consolidate them into a single evaluation anyway. Maximizing your claim requires objective, measurable proof of specific functional limitations. A single, well-documented claim proving severe loss of motion will always outscore a dozen overlapping diagnoses. You get a 60% rating for your back and a 30% rating for your shoulder. You assume you have a 90% rating. The VA sends you a letter saying you are 70% disabled. This is the combined ratings table, commonly known as VA math. The system does not add your ratings together. It calculates your disability based on your remaining efficiency. This chart breaks down the math. You start as a whole person, represented by this block of 100% working efficiency. First, your highest rating is deducted. We take away the 60% for your back. You now have 40% remaining efficiency. Here is where the math shifts. Your 30% shoulder rating is not added to the 60. It is calculated as 30% of your remaining 40% efficiency. That equals exactly 12%. The VA adds that 12 to your original 60, giving you 72%. They then round to the nearest 10, leaving you with a final combined rating of 70%. The closer you get to a 100% rating, the smaller your remaining efficiency becomes. It gets mathematically harder to bridge the gap with minor 10% claims. There is a critical exception to this formula. It is called the bilateral factor, and it applies whenever you have compensable disabilities affecting paired extremities, like both arms or both knees. If you have bilateral issues, the VA combines the ratings for those specific paired limbs and then adds a flat 10% boost to that value. This happens before they calculate the rest of your body, creating a mathematical advantage that cascades through your entire rating. Knowing how VA math works changes your strategy. It proves that focusing heavily on the severity of your primary injuries and bilateral conditions is far more effective than chasing redundant, low-value claims. Preparation requires the worst day strategy. The VA does not evaluate you based on a quiet Sunday afternoon on the couch. You must describe your functional limitations based on severe flare-up days. When you walk into the exam room and the doctor asks, "How are you doing today?" answering, "I'm fine," is a mistake. The examiner can legally record that as a medical observation of zero physical distress. Your execution depends entirely on where you are in the claims process. This flowchart maps the priorities. If you look at Path A, a first-time filer has two jobs: legally linking the injury to their service and demonstrating base functional loss. Do not just say your knee hurts. Give them the metric. State clearly that your knee pain prevents you from standing for more than 15 minutes, making it impossible to perform your required duties. If you are an appeal filer on Path B, your job is auditing the VA. You check their math. You verify they applied the bilateral factor. You ensure they didn't illegally lump distinct conditions together under the pyramiding rule. The C&P examiner is an auditor, not a healer. By understanding the federal rating rubrics and the mathematics behind the system, you can accurately translate your lived reality into the exact compensation you earned.